And joining me now is Dr. Lane Rowland, virologist and infectious disease expert, to help us break that all down and answer some questions for us. Dr. Rowland, always a pleasure. Welcome back to BNC Live. So you just heard Texas GOP candidate Allen West has COVID. He's taking that drug that Trump allies have been promoting. Is this drug effective? I mean, the FDA claims it's not when it comes to treating COVID, but we keep hearing people taking it. What do you make of that?
Well, good evening and super Sunday night to all the BN staff. The reality, folks, is that the ivermectin and malaria medication do not have any effect on the SARS-CoV virus at all. I mean, the reality is that ivermectin is a medication used for treating parasites, helminth infections, hookworms, roundworms, threadworms. And I've treated thousands of patients in the Amazon jungle with this medication. And on the other medication, the malaria medication, has no mechanism of action that shows that it does inhibit the viral load or inhibits the virus from infecting. In fact, both these medications do not have that type of ability to do that. There might be some anecdotal clinical studies out of Chile that they said that they had some people that had some, some type of effective treatment, but in the reality, that medication does have nothing. It's got into the realm of propaganda and conspiracy theories. And I like to tell people, if you really truly believe that this malaria medication, ivermectin, are so effective, you have to realize that 90% of the people live between the tropical of Cancer and tropical of Capricorn, which is the equator. And guess what, folks? 90% of the people on the planet have worms all the time. And they're treated for worms with ivermectin and malaria medication for malaria. In fact, in Mexico, the people in Mexico have to take that pill twice a year to make sure that they were getting rid of the worms in the population. If there was any evidence that this medication, malaria and ivermectin, had any effect, there wouldn't be one SARS-CoV case in the world, because 90% of the people take this medication on a regular basis.
So can you talk about how this is adding to misinformation? Because again, Trump allies have been pushing these two drugs as treatment for COVID.
Well, that goes back to the beginning. It's not being mad at somebody. The reality is that we got politics involved into the infectious disease world that people are not even trained. You remember Trump was telling you to put your head in a microwave, shoot yourself with bleach, drink Clorox. This is going to go away in the springtime. And this is one of these conspiracy theories where people have just, held on to. And this is the problem that we have, because we have misinformation, disinformation, and not correct information based off of science and medicine. And so you can see how there's a certain amount of the population that believe in ivermectin, and ivermectin has no effect on the SARS-CoV virus. I've looked at it, I've studied it, I teach my students how to use the medication. It is on my exam. It's a mechanism of action of malaria and ivermectin, and the mechanism of action of both these drugs have no ability to inhibit or decrease the viral load or inhibit the virus from affecting the individual.
Got it. And it's worth noting that the White House has been on a campaign to fight misinformation and disinformation as well. Dr. Rowland, kids under 12 are the latest round to be eligible for a COVID shot, with Pfizer asking the FDA for emergency use authorization. Now, in terms of prevention, will this help, even though we have 67 million unvaccinated eligible Americans?
Well, in my opinion, I'm a pro-vaccine individual. On this one, I don't think any child should be injected with this vaccine until they have proven studies that they have been out for a while that shows that this thing has this type of vaccine effectiveness. In reality, this is really an experiment on our children, just to keep it real. And if you want to play the devil's advocate and say this vaccine for the children are going to make a decrease in case, how can it make a decrease in case when the effective antibodies of the Pfizer vaccine only lasts 85 days? Now we know that the antibodies are down to 2 months. So what are you going to start doing once you start injecting children? You're going to have to inject children 2 or 3 times a year. And I want to see the results of that. And I want to see how the vaccine effectiveness is really decreasing the amount of cases. The reality is that if they go down this road, they're going to have to test every kid and look for their antibodies to see if these children have neutralizing antibodies. And it doesn't make, to me, it's different because I believe that you have to have a combination of both. You got to have a combination of your natural immunity where you're affected and you're able to fight an infection. And also you have the ability to have vaccines that have some type of mitigation in that, but that mitigation has to be vetted. It has to be understood. We have to know the mechanism of action, and we have to understand what the long-term function of the vaccine. And when it comes to children, children should not be experimenting on it unless we know with a definite 100% certainty that this vaccine is going to work.
So Dr. Rowland, I'm sorry, are you saying that once the FDA gives emergency use authorization, you are advising parents not to vaccinate their child?
I'm not advising anybody to do anything. They're going to have to make the best decision for themselves.
But you wouldn't vaccinate your own child?
I would not vaccinate my children until I feel that the results, the information has been proven and vetted. And I know that if my child gets a vaccination, they're not going to have a complication. Because I don't want nobody coming back 6 months or a year from now and telling me, oh, there's another complication for the vaccine.
Dr. Rowland, hold that thought. We got to take a break. I want to pick up on this conversation right after. You're watching BNC Live. We'll be right back to have a candid COVID conversation with Dr. Lane Rowland. Stay with us. Welcome back to BNC Live. We're having a candid COVID conversation with virologist Dr. Lane Rowland. Now, Dr. Rowland, before we went to the break, you were very adamant, and it was quite an interesting stance. You basically said once the FDA authorizes emergency use for kids under 12, that you personally would not be vaccinating your children. You said you need more information. So I want to continue that conversation, and let's talk about vaccine side effects. There are some people who have experienced chills and uncontrollable shaking for several hours after their second shot. But what about several months? I know someone personally who has suffered from uncontrollable shaking for months after taking that second dose. Is this a reaction or is this an adverse effect of the vaccine? And I know you don't treat this person.
Yeah, but this is an adverse effect, and this is the story that we keep hearing. And this is a reality on any vaccine, and more in particular this vaccine. I mean, I was on a program the other day, and one of the ladies from the Netherlands called into the show and said, you know, over 10,000 females are having bleeding dysregulatory problems with their menstruation. That is a fact. These women are not crazy. We know that Moderna has been pulled from Sweden and also the Netherlands because it causes myocarditis of the heart. We know that viruses have complications, as we talked about this a year ago on this program, causing people to have Bell's palsy, causing people to have Guillain-Barré syndrome. This is part of the phenomena of any vaccine, and these are adverse effects. You know, it could be neural problems, it could be skin problems, but this is why it takes 3 to 10 years for vaccines to come to fruition, because you have to study it. You have to know what are the complications. What happens if you inject 1,000 5-year-old children that have the sickle cell trait? What happens if you inject 8-year-olds, 1,000 of them that have Down syndrome? This is the reality, and the reality is that we do not have enough time on a vaccine that's been out here for less than a year to make these leaps and assumptions that this thing is going to do what it's going to do. And we know, you just said it yourself, you have friends that have complications. And it's not a figure of their imagination, because I've heard thousands of different stories. But the narrative is that this is the be-all, the solution, but it's not. And that's why I tell people, if you go down the vaccine route, you need to make sure that that famous word and be informed, have informed consent. You need to know everything. And then the most important thing is that people need to get their neutralizing antibodies. The neutralizing antibodies are the things that are supposed to protect you from the virus, viral load, viral infection. And here's the deal. If you do not know what your neutralizing antibodies are, how do you know you actually got effective immunity? And then also to that, folks, if you are a normal individual, your life is going great, you're a diabetic, it doesn't matter what your condition is, and you take the vaccine, and that takes you out of your normal homeostasis, where you are sick, you maybe have diarrhea, you have neuritis, pain in your back, menstruation problems, et cetera, et cetera, et cetera. This is not a figure of your imagination. This is an adverse effect.
Okay. Dr. Rowland, you did mention that people need to do their own research. But people they don't have medical degrees like you, sir. And if the CDC website says the vaccine is safe, where are you suggesting they get their information from?
Well, they need to vet it themselves. They need to find somebody in their community, somebody that has that type of expertise, and have them sit down and have a conversation about these are the benefits of this and that. Now, people like to quote the CDC. The CDC always gives you guidelines, but if something happens to you, you cannot sue the CDC. But they're giving information out there. And you have to understand this is a problem that we've had with vaccine hesitance, because people understood what happened with the syphilis experiment, and the CDC was a part of that. And so you have to look at both sides and make sure that you vet the information, not just from the CDC, but from everybody, to make sure that you're informed and you understand it, the science, because you're the one who are going to have to pay the consequences, be it good or bad. When you make a good decision, it's a decision that you make, and you need to make sure that that decision is vetted in science and medicine and not a theory.
Dr. Rowland.